Hi, dear all viewers. Now, my intention is to deliver a lecture on Anterior Lateral Spinothalamic Tract. This is a ascending tract. Name is, again I am repeating, Anterior Lateral Spinothalamic Tract. Anterior Lateral Spinothalamic Tract. Spinothalamic Tract. Now, let me give the explanation on this tract first. Here, if we draw the section of the spinal cord, here it is the cross section of the spinal cord. Our aim is to talk on Anterior Lateral Spinothalamic Tract, means origin is spinal cord and termination point is thalamus. That is why this is called spinothalamic tract. But anterolateral, here we have the column, anterior column, this is anterior column, this is lateral column, this is lateral column, this is anterior column, this is anterior column, and this is lateral column. In my previous lecture, I talked on dorsal medial lemniscal system, where I told you about the two bundles here in the dorsal column. But in this, I will not be talking about the tract which is present this dorsal column. I will be talking about the tract which is present in the lateral column as well as the anterior column. So that is why this tract is called Anterior Lateral Spinothalamic Tract. What is the function of this tract? The function of this tract is to carry the sensation of pain and temperature. In my introductory lecture, I have told you about the different type of pain carried through this tract and the temperature. And the second is this crude touch. Third is sexual sensation. And fourth is pressure. Sensation of pressure also is carried by this anterior lateral spinothalamic tract. Now, coming to the pain pathways, if we talk about the receptors carrying pain sensations, this is the receptors for pain. That is what the name of the receptor is, free nerve ending. Okay, this free nerve ending is their receptor, and this will inform the condition of the tissues. If tissue cells are deteriorating, then there is a particular chemicals will be available here, and accordingly this receptor will be stimulated, action potential will be formed, and then this fiber will be terminated in the spinal cord. Another fiber, that is the C fiber, that is the A delta fiber. The fiber, first order neuron, it is A delta fiber. It is myelinated fiber. And another is C fiber. Another is C fiber. This also will be terminated in the specific area of the spinal cord. We call it substantia gelatinosa. This is the substantia gelatinosa. Substantia gelatinosa. This is the first order neuron. Then what will happen? The fiber, the second order neuron for first pain. This is the fast pain, this is the fast pain, and this is the slow pain. This is the slow pain is carried by the C fiber. This is C fiber carried slow pain, and this is unmyelinated fiber. This is unmyelinated fiber and this is myelinated fiber. So the second order neuron will cross and will move towards the brain, towards the cerebral cortex. And here, look at carefully. For C fiber, we will have many neurons here. We will have many neurons here. Many neurons here. We will have many neurons here. Then all neurons will be moved up. So I have drawn the two pathways, one for fast pain, another is for slow pain. Fast pain, here there is no breaking, means the fiber is crossed and enter into this bundle and going up. But in this case, slow pain, here we can get the many fibers here, connecting fibers are here, and ultimately they will be united. And this is second order neuron. This is second order neuron. Now coming to the crude touch. Crude touch, if we talk about crude touch, then crude touch, where is the crude touch? For crude touch, the receptors for crude touch, and again this will enter into the substantia gelatinosa. Substantia gelatinosa, and the second order neuron will enter into the anterior horn and it will go up. So what I have told you is the arrangement of first order neuron for fast pain, slow pain and crude touch. All first order neurons for fast pain, slow pain and crude touch terminated in the substantia gelatinosa. But for pain fiber, they will move through lateral column, but the crude touch that will move through the anterior column. Then let us see how the second order neuron, where the second order neuron is terminated, and then the later part. We are talking about Anterior Lateral Spinothalamic Tract. This tract is responsible to carry pain, temperature. This tract is responsible to carry pressure sensation, sexual sensation, and the crude touch. So I have drawn the diagram. Again, if you look at this diagram, this is the receptor, free nerve ending, free nerve ending. This is the receptor for free nerve ending. This is the receptor for free nerve ending. This is A delta fiber. This is C fiber, and this is the fiber carrying the crude touch. This is myelinated. This is unmyelinated. This is myelinated. And look at this diagram. In case of fine touch, there is no braking system. Directly it will cross and it will be available in the lateral column of the spinal cord. Lateral column of the spinal cord, and is going up. In case of C fiber, braking is there. Fiber connector, too many connected neurons are there, and then ultimately this fiber also will cross and will present in the lateral column. In case of crude touch, the receptors will be stimulated. This is the ganglia, that is dorsal root ganglion. Then the nerve ending is in the substantia gelatinosa, and then the second order neuron starts and it will cross, and then there is anterior column, and this fiber will present in the anterior column. Now what will happen in the medulla? Here the fiber will be united here. This fiber will be united here. This fiber will be united here in the medulla. In the medulla, this fiber will be united here in the medulla, and then it will go up. So this is united here, and this will go up. This is again the bundle is called. This bundle is called spinal lemniscus. This bundle is called spinal lemniscus. All of you have come to know about medial lemniscus, that is dorsal medial lemniscus. But here I am talking about spinal lemniscus. Lemniscus means if we go through cross section, it is flattened shaped, so that is why this is called lemniscus. But in case of anterior lateral spinothalamic tract, the bundle is called spinal lemniscus. Now, what is the termination point? Here, the fiber, all the fibers before enter into the thalamus, this will inform to the reticular formation. Both slope and crude touch, fine touch will inform to the reticular formation, and then the fiber will enter. This is the Y-shaped. This is Y-shaped. This is Y-shaped. This is Y-shaped. This is Y-shaped. Please carefully listen. In case of first pain fiber, this is the second order neuron, and this second order neuron is terminated in the ventral posterior nucleus of the thalamus, and then we have here internal capsule. Here we have the internal capsule. Through internal capsule, this will inform to the sensory areas of the cerebral cortex. Which fiber I am talking about? Fast pain fiber. But the slow pain fiber is terminated in the intralaminar nuclei. This nuclei is called intralaminar nuclei. Laminar nuclei. So slow pain fiber terminated here in the intralaminar nuclei, and then here we have a center. We call it cingulate gyrus. Here we have cingulate gyrus. Now, what is the function of the cingulate gyrus? This cingulate gyrus is actually center for emotion. आप सबको ये जानकारी देते हुए मुझे खुशी मिलेगी कि जब पेन होता है तब आदमी हंसता है क्या रोता है? रोता है, हंसता नहीं है. चाहे कोई आदमी अगर हंस भी रहा है तो in that case also this center is activated. How? The third order neuron is terminated here. Third order neuron is terminated in the cingulate gyrus. At the same time, the third order neuron is terminated in the all areas of the cerebral cortex. And there is another center we have here is insula. Insula. This is the insular cortex, and this insula is actually the stimulating point of autonomic nervous system. Means this insula controls the activity of autonomic nervous system. Autonomic nervous system में कौन होता है? Autonomic nervous system में we have sympathetic and we have parasympathetic. Now look at this. The third order neuron is supplying or stimulating the insula also. Means, again, please apply your brain. At the time of pain, our heart rate increases. At the time of pain, our blood pressure is increased. That is because of the stimulation of sympathetic. Means, what I want to tell you is this C fibers, third order neuron of C fiber is terminated in the insula. Insula is stimulated. Once insula is stimulated, autonomic nervous system is stimulated. Autonomic nervous system stimulates the sympathetic. So we have both increase with the heart rate and increase with the blood pressure. So this changes actually at the time of pain comes from the stimulation of the insula. Stimulation of the insula. Now the crude touch also it will be terminated in the medulla as well as the interlaminar nuclei, and crude touch also fiber is terminated in the cingulate gyrus in the primary areas of the cerebral cortex, and as well as it will stimulate the insula. Another important aspect in this anterolateral tract system is, if you remember, all of you have seen the national highway. In this national highway there is a service lane, and this service lane it is not in everywhere, जगह जगह पे सर्विस लेन मिलती है. तो here also there is a service lane. ये जो फाइबर आप देख रहे हैं, this fiber I am talking about this in the spinal cord. See, this is the diagram of the spinal cord. This is the diagram of the spinal cord. This is the diagram of the spinal cord. Diagram of the spinal cord. Now here this fiber is terminated. Say pain fiber is terminated here. Now this termination point, if we look at here we have see what I am. There is a branch of this fiber. There is a branch of this fiber. There is a branch of this fiber. Now from here also the similar diagram we can draw. There is a branch of this fiber. There is a branch of this fiber. There is a branch of this fiber. 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 Terminated here. So this made a line here. This made a line here or tract. We call it dorsolateral tract of leisure. How you pronounce it? L-I-S-S A-U-R-E. Leisure. How you pronounce it? Leisure. So this service lane I am talking about. There is another tract or service lane will be seen in the spinal cord. White column I am talking about, and that is called dorsolateral tract of leisure. Now, while formation of this service lane or tract of leisure, there is a nuclei we can see here. Means main point I am talking about. That is called Clark's column. So in this we can see the nuclei. We can see the nuclei here, and that is looking like a stand. We call it Clark's column. So this is the, again, if I am just finishing this topic. Here we have the pain sensation, pain receptors. This is the first order neuron, will be terminated here in the substantia gelatinosum. Second neuron starts for fast pain and slow pain. This will move through lateral column, and for crude touch this will move through anterior column, and then in the medulla it is united here. And forming the column we call it spinal lemniscus. It is terminated in the thalamus, and then the fiber third order neuron is terminated in the primary sensory area of the cerebral cortex, cingulate gyrus and insula. Cingulate gyrus is center for emotion. We can see patients suffering from the pain. Sometimes they also start weeping, start crying. So that is the emotional aspect, and that comes from the stimulation of cingulate gyrus. And the third order neuron also stimulates the insula. So at that time there is increase in the heart rate, blood pressure. So that comes from the stimulation of the insula. Insula actually regulates the autonomic nervous system. So this is a short story about ascending tract which is carrying pain and temperature sensation. Thank you. You might have gone through Anterior Lateral Spinothalamic Tract, where I have talked about how the pain is transmitted, how pressure is transmitted, how crude touch is transmitted. I have drawn the diagram of Anterior Lateral Spinothalamic Tract. In this tract also there are three neurons. One is first order neuron, second order neuron, and third order neuron. Now, I will be happy to tell you about the analgesia system, how the pain is inhibited. This topic, pain transmission, pain perception, and pain modulation, three terms you will get. One, pain transmission, another is pain perception, and third is pain modulation. What are the difference between three words? Transmission means it is the pathway which transmits the pain response, that is the pain transmission. Three neurons are there, first order neuron, second order neuron, and third order neuron. Now coming to the pain perception. Pain perception means, if I give an example, suppose there is a problem with your body, means somewhere there is a pain and you are feeling that pain. If someone slap you, then that pain is different. Means if someone slap, that pain is different. And this pain which is coming from your body, if any abnormality or anything, that pain is different. So that is the perception. Someone slaps, 2 days, 3 days, 4 days, you cannot sleep properly because person has slapped you. So that pain is perception. And then pain modulation, how we can reduce the pain, that is the pain modulation. So that topic I am going to deliver. The term is analgesia. Physiology of anti-pain or analgesia, how the pain is inhibited. Now, one practical experience I want to share with you all. If there is any pain, say there is a, you look at this hand, some acid is there, acid is thrown here, and you are feeling the pain. So what you do is generally you go for rubbing. You go for rubbing or you go for massage. So what is happening there? Say this is the pathway, that is the fine touch or pathway for the massage. This pathway actually we will find in the dorsal column. And then this is the pain pathway. And the pain pathway nerve ending first order neuron will find the substantia generative. And then the second order neuron starts. Now here, if we look at this pathway, I am talking about the massage, which will reduce your pain. How it will reduce your pain? So there is a collateral we can see here, collateral. So look at this collateral. This fiber is going up. This is the fiber for massage and gives the collateral. This is the nerve ending, and here we have the neurotransmitter. So this neurotransmitter may be glutamate, may be substance P. So this neurotransmitter, what we will do is, this neurotransmitter will act such a way, so there will be a no action potential, or the action potential will be reduced. Action potential will be reduced. So action potential will not be transmitted. Means action potential for what? Pain. This action potential will not be transmitted to the central nervous system. So here it acts as a gate. This theory by which this collateral, maybe there will be a connector here, another connector here. Here there is another small connector is there, and this connector also secretes the neurotransmitter and reducing the pain, means reducing the generation of action potential. So there will be a EPSP or IPSP. There will be IPSP. So there is a generation of IPSP here, and this IPSP ultimately there will be no action potential, so there will be no pain. no pain. So this way massage or rubbing can reduce your pain, and it acts like a gate. If you close the gate, then there will be no pain. So this theory is called gate control theory. Look at this diagram here. I have drawn few areas in the central nervous system which can reduce pain. That is the descending pathways. The nuclei present in the central nervous system just below thalamus. It is called periaqueductal gray area. Periaqueductal gray area, and another is rapha nuclei present in the midbrain. So this nucleus or this nuclei through descending pathways, the nerve ending will present here, nerve ending in the spinal cord. So if we stimulate all these areas, our pain will be reduced. Our pain will be reduced. So this neurotransmitters is enkephalin, morphine, enkephalin. These are the neurotransmitters released from the nerve ending, and there will be a no pain. So this actually descending analgesic system, and this descending analgesic system also can reduce our pain. The center for this is periaqueductal gray area, just below thalamus we will have, or we will have the rapha nuclei present in the midbrain. All can send their neuron towards the spinal cord, and the pain will be reduced. If you go to the clinician, they will give you morphine. So that is also the neurotransmitter which can act on the neurons present in the spinal cord, which is carrying the pain sensation. So our pain perception will be less, and we can modulate our pain. So three terms: pain transmission, pain perception, and pain modulation. So this is the analgesic system we will have. One is gate control theory, and another is descending analgesic system. Thank you.